when you want to assess the dependence of tobacco, you take two scales, that is the Fagerstorm scale for assessing the tobacco dependence of smoking type of tobacco, and the other one is the assessing for the smokeless type of tobacco. Coming on to the smoking type of tobacco Fagerstorm scale, we ask a set of 6 questions. The first question is, how soon after you wake up you have your first cigarette? So if the patient's reply is if it is within 5 minutes, then you give a score of 3, and if it is 6 minutes to half an hour, you give a score of 2, and if it is 31 minutes to 60 minutes, you give a score of 1, and if it is after 1 hour of waking up, you give a score of 0. So then you ask, the second question you ask is, do you find it difficult to refrain from smoking from public places like bus stand, church, or if it doesn't find it difficult, then you give a score of 0, and if it is finding difficulty in that, you give a score of 1. And the third question is, which cigarette you ask is, which cigarette you hate giving up the most. If the patient's reply is the first cigarette early in the morning, then you give a score of 1, and if it is something afterwards, then you give a score of 0. And the fourth question is like, how many cigarettes you smoke in a particular day. So if the score is, if the cigarette is number of cigarettes is less than or equal to 10, it is 0, and if it is 10 to 20, if the score is 1, and if it is like 21 to 30, the score is 2, and if it is more than or equal to 31, the score is 3. So the fifth question is, do you smoke more frequently during the first hours after waking up or during the rest of the day? If it is a yes, then the score is 1. If it is no, the score is 0. And the last question is, do you smoke if you feel so ill that you fall asleep on the bed for prolonged hours? Even in spite of being so sick, you smoke a cigarette, then the score is 1. If not, the score is 0. So you add up all this cumulative scores, and at last you will be assessing whether the patient is mild to moderately dependent on tobacco or severely dependent on tobacco. Based on that, you decide whether you go for behavioral counseling or the patient need pharmacological interventions.
Sir explained about the Fagerstorm test for nicotine dependence scale for smoking tobacco. Now we are going to see about the Fagerstorm test for nicotine dependence scale for smokeless tobacco, and it is a standard instrument for assessing the intensity of physical addiction to nicotine. The test was designed to provide an ordinal measure of nicotine dependence related to smokeless consumption of tobacco. It contains 6 items that evaluate the quantity of cigarette consumption, the compulsion to use, and dependence. In scoring the Fagerstorm test for nicotine dependence, yes or no items are scored from 0 to 1, and multiple choice items were scored from 0 to 3. The items are summed up to yield a total score of 0 to 10. Higher the total Fagerstorm score, the more intense is the patient physical dependence on nicotine. The Fagerstorm nicotine dependence scale for smokeless tobacco, the questionnaires are: first question, how soon after you wake up do you place your first dip? That is, within 5 minutes the score is 3, 6 to 30 minutes the score is 2, 31 to 60 minutes the score is 1, after 60 minutes the score is 0. Moving on to the second question, how often do you intentionally swallow the tobacco juices? Always the score is 2. Sometimes the score is 1, never the score is 0. Question number 3. Which chew would you hate to give up most? The first one in the morning, the score is 1. All others, the score is 0. Moving on to the fourth question. How many cans or pouches per week do you use? More than 3, the score is 2. 2 to 3, the score is 1. 1, the score is 0. Question number 5. Do you chew more frequently during the first hour after awakening than during the rest of the day? If it's yes, the score is 1. If it's no, the score is 0. The final question number 6. Do you chew if you are so ill that you are in bed most of the day? If it's yes, the score is 1. If it's no, the score is 0. Now we are going to discuss about the overall scoring of nicotine dependence on both smoking and smokeless form of tobacco. In scoring the Fagerstorm test for nicotine dependence, the items are summed to yield a total score of 0 to 10. The scoring 0 to 3, no or low tobacco dependence, patient not need nicotine replacement therapy or treated with single agent NRT. Single agent NRT means lozenge, gums, inhaler or nasal spray. Scoring 4 to 6, moderate tobacco dependence treated with a combination of nicotine replacement therapy, long acting with short acting, that involves the use of long acting nicotine formulation patches in combination with the short acting formulations gums, lozenge, inhaler or nasal spray. Scoring 7 to 10, high tobacco dependence can be treated with a combination of nicotine replacement therapy with oral agent. The oral agent means varenicillin, bupropion. Based on this scoring criteria, decision should be taken to give treatment on non-nicotine replacement therapy or nicotine replacement therapy.